Unveiling Truth, the comprehensive presentation of evidence in a sexual assault case. Ladies and gentlemen, good morning, afternoon, evening, and welcome to today's special presentation where we delve into a sensitive and crucial topic: presentation of evidence in a sexual assault case. Our goal is to shed light on the various forms of evidence that come together to build a compelling case. Today, we will explore the realms of autopsy findings, documentary evidence, circumstantial evidence, and witness testimony. Let us embark on this journey to seek justice and truth. Our first piece of evidence is the autopsy report, a critical component in understanding the physical aftermath of the alleged assault. Dr. Especialista, a seasoned forensic pathologist, will guide us through the details. Thank you. Autopsy findings play a pivotal role in sexual assault cases. In this instance, the victim's body becomes a silent witness, telling a story that is often difficult to express in words. We meticulously examine injuries, collect DNA samples, and piece together the puzzle of what transpired. Can you elaborate on how the autopsy findings contribute to the overall case? Certainly. The presence of injuries, DNA evidence, and other forensic clues can help establish a connection between the victim and the alleged perpetrator. It provides a factual foundation for the legal proceedings. Moving forward, let's explore the role of documentary evidence. This can include medical records, text messages, social media interactions, or any other written or recorded evidence that paints a picture of the events leading up to and following the alleged assault. Documentary evidence is like a chronological map of the case. It helps establish timelines, relationships, and emotions. In sexual assault cases, texts, emails, or medical records can be crucial in understanding the dynamics between the parties involved. How does the legal system use documentary evidence to build a stronger case? Documentary evidence serves as a foundation for establishing patterns of behavior, consent, or lack thereof. It aids in creating a comprehensive narrative that the jury can follow, making it easier to understand the context surrounding the alleged assault. Circumstantial evidence is often a misunderstood yet powerful form of proof. To discuss its role in a sexual assault case, we have legal expert joining us. Circumstantial evidence may not be as direct as eyewitness accounts, but it can be equally compelling. It involves drawing inferences from facts that, when considered together, lead to a reasonable conclusion. How can circumstantial evidence strengthen a sexual assault case? Circumstantial evidence can fill gaps in the narrative. It supports or corroborates other forms of evidence, making the overall case more robust. For example, establishing a lack of consent through a victim's demeanor or actions captured on surveillance footage. Lastly, let's explore witness testimony, a human element that adds depth and emotion to the case. Joining us is attorney Umaman now. Witness testimony is often the heart of a trial. It humanizes the evidence, allowing the jury to connect emotionally with the victim's experience. This can include the victim, bystanders, or professionals involved in the case. How does witness testimony impact the outcome of a sexual assault case? Witness testimony provides a first-hand account of events. It can establish the credibility of the victim and offer additional perspectives, creating a more nuanced understanding for the jury. However, it's essential to recognize that witness testimonies can also be challenged and cross-examined during the trial. In conclusion, a sexual assault case is built on a foundation of diverse evidence: autopsy findings, documentary evidence, circumstantial evidence, and witness testimony. Each piece contributes to the overarching narrative, helping to uncover the truth. As we navigate the complexities of these cases, let us remember the importance of empathy, understanding, and a commitment to justice. Thank you for joining us on this exploration of the multifaceted nature of evidence in sexual assault cases. Be safe and secure. Kaya lahat dayan lagi, gawa kababayan.
Working on debris and samples collected from a fatal fire scene investigation. This is your typical forensic science specialist. Representative samples from fire debris are then taken and subjected to high-tech state-of-the-art forensic laboratory of the NBI or PNP Philippines.
First-degree superficial burns. In first-degree burns, the outermost layer of the skin, the epidermis, is affected. These burns are often characterized by redness, pain, and mild swelling. First-degree burns are considered superficial and typically heal without scarring. Second-degree partial thickness burns. Second-degree burns affect both the epidermis and part of the underlying layer, the dermis. They are more painful than first-degree burns and may present with blistering, redness, and swelling. Second-degree burns can lead to scarring if not properly treated. Third-degree full-thickness burns. Third-degree burns are the most severe and extend through the epidermis and dermis, affecting deeper tissues such as fat, muscle, or bone. The affected skin often appears charred, white, or blackened. Nerve endings may be damaged, leading to an absence of pain at the burn site. These burns require immediate medical attention and often necessitate skin grafts and surgery for healing. Fourth-degree deep tissue burns. Some sources categorize extremely severe burns as fourth-degree burns. These burns extend beyond the skin, affecting deep tissues, muscles, tendons, and bone. The damage is extensive, often with charred and necrotic tissue. Survival with these types of burns is rare, and they usually result in significant disability or death. It's important to note that the classification of burns is based on the depth and severity of tissue damage. In the context of forensic investigations involving burned bodies, the assessment of the degree of burning can provide important information about the cause of death, the circumstances of the incident, and potential accelerants used in the burning. Additionally, the analysis of burned remains may involve methods like histology, DNA testing, and other forensic techniques to determine the identity of the deceased and the cause of the fire.
Fraternity hazings are common and frequently unreported. Overseas and in the Philippines, in schools, universities, secret societies, military, community police organizations, neighborhood clubs, and government investigative agencies, among others. A few had fatal outcome, and those involved are languishing in jails. Those who survived hazings may have physical, mental, traumatic experiences, and post-traumatic stress disorders. Sexual abuse is common in hazings. Hospital emergency rooms are stressed when hazing cases present. Alcohol intoxications are common and less commonly severe body bruises and skin burns. Those who die of blunt injuries, like widespread severe bruises to the upper and lower extremities, suffer severe acute kidney failure due to myoglobinuria. Some suffer loss of blood in chest and abdominal cavities and brain hemorrhages. Parents should be cautious and vigilant in taking care of their children who are starting schools and universities as a prevention of hazings.
Histological analysis of short-term vital reactions in skin wounds involves studying the cellular and tissue changes that occur in the immediate aftermath of injury. These reactions typically include inflammatory responses, cellular migration, and tissue repair processes. Histology, or the microscopic examination of tissues, allows for the detailed observation of these changes. Some key aspects of histological analysis of short-term vital reactions in skin wounds include inflammatory response. This involves the recruitment of immune cells such as neutrophils and macrophages, dilation of blood vessels, and release of inflammatory mediators to clear debris and pathogens from the wound site. Cellular migration, various cells, including fibroblasts and endothelial cells, migrate to the wound area to initiate tissue repair and angiogenesis, formation of new blood vessels. Tissue repair. This involves the deposition of extracellular matrix components, like collagen and elastin, which contribute to scar formation and wound closure. Applications in forensic work. Understanding the histological changes in short-term vital reactions in skin wounds can have several applications in forensic investigations, estimation of time since injury. Histological analysis can help estimate the age of a wound by examining the stage of wound healing. This information is crucial in determining the timing of an injury in forensic investigations. Within 6 hours, acute inflammation is still working in the skin. Whether the person is alive or passed away, kaya pag na-injure pa yung skin ang isang decedent. One can't distinguish under the microscope if antemortem or post-mortem. History now long ang nagsasabi how the body of the decedent was handled. John papasakang isang forensic pathologist to decide in the conclusion and personal opinion, differentiating antemortem and post-mortem wounds. Examining cellular responses and changes can aid in differentiating wounds sustained before death antemortem from those occurring after death post-mortem. Identifying cause of death, histological analysis can assist in determining whether a wound was fatal or contributed to the cause of death. Fibrin in acute inflammation. Fibrin is a protein involved in blood clotting and wound healing. During acute inflammation, fibrinogen, a soluble plasma protein, is converted into fibrin strands, forming a meshwork that helps to staunch bleeding at the site of injury. Fibrin also serves as a scaffold for cells involved in the healing process, aiding in tissue repair. Future in skin wound forensics. The future of skin wound forensics may involve advancements in techniques that allow for more precise and rapid histological analysis, such as advanced imaging technologies, development of high-resolution imaging methods or molecular imaging techniques too. Study wound healing processes at a cellular or molecular level. Biomarker identification. Discovery of specific biomarkers or molecular signatures in wounds that can aid in determining wound age or other forensic aspects. Integration of multiple disciplines. Collaboration between forensic pathology, histology, molecular biology, and other disciplines to create a comprehensive approach for analyzing wounds and providing forensic evidence. Advancements in these areas could significantly enhance the accuracy and efficiency of wound analysis in forensic investigations. What is inflammation and its classical signs? In Tagalog, it is pamamaga. Inflammation is the reaction activity of a living tissue due to an injury. It can be acute, chronic, or subacute. The signs are redness, rubor, heat, calor, swelling, tumor, pain, calor, and loss of function, functiolasa. Remember the Latin words rubor, calor, tumor, calor, and functiolasa. So, if your finger has been injured by a pinprick, it will show redness due to increased blood flow to the area. Some heat due to effective increased blood flow, has pain due to mechanical pressure on nerve endings, and loss of function because you can't use your finger for typing on your keyboard on your desktop or smartphone. Inflammation is acute when sudden or of recent onset, chronic when ongoing for some time, and subacute when in between in timeline. If your name is Doler, you are literally always in pain. See you next time and see more posts on inflammation. Cheerio!
Explaining your role as a healthcare provider. Create a safe and comfortable environment for the survivor to share their experience, express empathy, and let the survivor know that you are there to support and help. History. Ask the survivor to provide a brief personal history, including their age, occupation, and any relevant medical conditions or medications they are taking. Social history. Inquire about the survivor's social history, including their living situation, relationship status, and support systems. Drug and alcohol use. Ask the survivor if they have used any drugs or alcohol before or during the incident. Use non-judgmental language and reassure them that your goal is to provide appropriate care. Physical injuries. Gently inquire about any physical injuries or discomfort they may be experiencing as a result of the assault. This should include any pain, bruising, bleeding, or any other noticeable physical harm. Psychological well-being asks about their emotional well-being and any psychological symptoms they may be experiencing, such as anxiety, depression, or flashbacks. After the encounter, ask the survivor about their immediate actions after the encounter with the assailant. This might include questions like, did you seek medical attention immediately after the assault? B, did you talk to someone you trust about what happened? C, did you preserve any evidence, such as clothing or other items involved? Medical examination and evidence preservation. Explain the importance of a medical examination for evidence collection and encourage the survivor to consider undergoing a forensic examination. Ensure they understand that they have the right to make this choice. Support services. Provide information about support services available to them, such as counseling, legal resources, and local organizations specializing in sexual assault survivor support. Consent and privacy. Throughout the interview, maintain the survivor's autonomy and consent. Make it clear that they can choose not to answer any question or discontinue the interview at any time. Closing and follow-up express gratitude for their willingness to share their experience and reassure them that you are there to help and support them. Let them know about the next steps in their medical care and the importance of follow-up. Remember that each survivor's experience is unique, and it is essential to approach the interview with respect for their emotional state and boundaries. The survivor's well-being and comfort should be the top priority throughout the process. Need to know about gunshot residue. Overview. Gunshot residue, GSR, also known as cartridge discharge residue, CDR, gunfire residue, GFR, or firearm discharge residue, FDR, consists of all of the particles that are expelled from the muzzle of a gun following the discharge of a bullet. It is principally composed of burnt and unburnt particles from the explosive primer, the propellant, gunpowder, and vaporized lead. The act of firing a bullet incites a very violent explosive reaction that is contained within the barrel of the gun, which can cause the bullet, the barrel, or the cartridge to become chipped. Meaning gunshot residue may also include metal fragments from the cartridge casing, the bullet's jacket, as well as any other dirt or residue contained within the barrel that could have become dislodged. Law enforcement investigators will swab people's hands to look for gunshot residue if they are suspected to have discharged a firearm themselves or were in close contact with one at the time discharge. In order to figure out if GSR is present in an area, chemical tests, such as the modified grease test and the sodium rhodizonate test, are performed. Any GSR samples are collected by swabbing with 5% nitric acid solution and onto a SEM disc for a confirmatory test with scanning electron microscopy. Scanning electron microscopy dispersive X-ray spectrometry, SMEDX, is used to determine the presence of gunshot residue as a confirmatory test. There are both inorganic and organic components in GSR. Organic GSR primarily consists of compounds classified as explosives or additives based on their chemical composition, and they are analyzed by analytical techniques. Hala hala, be careful with guns. Lagi kayo diyan kung san man kayo. Be safe, secure, always, all. More on next postings about gunshot residue and cartridges. Reference: Wikipedia and Forensic Medicine for Medical Students.
After several sessions with a forensic psychologist, Sandra was subpoenaed to appear in an open court of law. Sitting on the witness stand, she is holding her teddy bear doll to make her less nervous, while a prosecution lawyer asks her direct questions concerning forensic case of psychophysical maltreatment Sandra received from her uncle. Her parents are not shown, but sitting among the nervous audience, an experienced lawyer handling years of similar cases can navigate easily in this situation to avoid giving Sandra another psychological trauma. The defense lawyer will then ask Sandra indirect questions.
Determining time of death using forensic entomology. Welcome to our educational series on forensic pathology. Today, we'll delve into an intriguing aspect of death investigation, determining the time of death using insects, a specialty known as forensic entomology. This approach can be crucial, especially when the post-mortem interval PMI extends beyond a few days where traditional methods may falter. Forensic entomology applies the study of insects and their arthropod relatives that inhabit decomposing remains to aid legal investigations. Insects are among the first organisms to colonize a dead body, and their life cycles are highly predictable. By identifying the species present and understanding their development stages, forensic entomologists can estimate the minimum time since the process begins with the body's exposure to the environment. Certain insects, particularly blowflies, are attracted to the body almost immediately after death. They lay eggs that develop through various stages, from eggs to larvae, then pupae, and finally to adult flies. This development is influenced by environmental conditions such as temperature, humidity, and geographic location. Succession follows, with different species colonizing the body in a predictable sequence as decomposition progresses. Early colonizers are typically blowflies, while later stages might attract Consider a hypothetical scenario: a body is discovered in a wooded area. The primary insect activity is from blowfly larvae, which are identified as being in the third larval stage. By referencing regional data on blowfly development, which indicates that this stage is reached within 72 hours under the current environmental conditions, investigators can estimate the time of death to within a 3-day window. While forensic entomology is a powerful tool, it comes with challenges. Environmental factors like temperature fluctuations and the presence of drugs or toxins in the body can alter the rate of insect development. Furthermore, the accessibility of the body to insects can affect colonization. These variables must be carefully considered to avoid inaccuracies in PMI estimation. Forensic entomology provides a vital method in the toolkit of forensic pathologists for estimating time of death, especially when conventional methods are not applicable. By understanding the life cycles of insects and their interaction with decomposing remains, forensic experts can offer crucial insights into the timing of death, thereby aiding in criminal investigations and the quest for justice. Thank you for joining us in this exploration of forensic entomology. Stay tuned for more insights into the fascinating world of forensic pathology.
Natusok ang finger ni Tonyo ng isang pako ng nakaraang 2 araw. Ngayon ay namamaga na, natibok ang sakit, namumula, at saka di niya magalaw-galaw ang kanyang isang finger. Umiiyak na sa sakit ng finger si Tonyo. Worried na si nanay, lolo ang perturb, lola. Kaya inihahanda na ang mga first aid kit nila. Dadalhin si Tonyo sa isang doktor para mabigyan ng antibiotic at saka injection ng anti-tetanus booster. Kaya mga bata, sabihin agad sa nanay nyo kung meron kayong sugat sa inyong mga kamay o fingers para maagapan agad ang infection and sakit na tetanus. Paalala sa mga bata at mga magulang na laging wash your hands and fingers with soap and water sa loob ng mahigit 10 seconds.
Forensic science in the Philippines is currently having teething episodes. Practitioners are steadily being absorbed into mainstream law enforcement agencies. Private companies, Justice Department, jail management, public safety agencies, among others. Upgrades are expected in the years to come. The country needs hundreds of certified forensic pathology practitioners in each government regions as well as forensic science practitioners. Currently, 3 forensic pathologists are certified and underutilized. To make the forensic pathology practice in the Philippines, we need to train more certified pathologists, undergo further training to contribute to upgrading our death investigation system to be world-class. We need to push the forensic pathology upgrade bill in the Senate, which still has to be acted upon since 1998. We are still hoping We should prepare for the increase of forensic science graduates and practitioners in the next 5 years or more, as well as certified criminologists.
Performing a forensic autopsy in cases of heart failure due to myocardial infarction or heart muscle death is a meticulous process that involves a series of steps and considerations to determine the cause of death. Below is a detailed step-by-step procedure with key considerations, techniques, tools such as photography and videography, and observations for conducting such an autopsy. Modern methods before autopsy are the use of X-rays, kinetic scan, and MRI. Preliminary examination. Record essential information, including the decedent's identity, medical history, and circumstances leading to death. Medical history needed. Document any external injuries or findings that may be relevant. External examination. Observe the general condition of the body, looking for signs of trauma, skin discolorations, or any abnormalities. Photograph external findings, focusing on any visible injuries or physical markers. Organ weights. Measure and record the weights of vital organs, heart, lungs, kidneys, and other specified organs, aorta, brain, pancreas, intestines. Compare organ weights to reference ranges to identify any potential abnormalities or hypertrophy of the heart. Heart weighs normally 0.45% of body weight. Y incision and thoracic cavity. Opening. Make a Y-shaped incision on the chest and abdomen. Expose the thoracic and abdominal cavities. Examination of heart. Carefully remove the heart and inspect it for abnormalities, such as infarctions, hypertrophy, or other structural issues. Document the size, shape, and presence of coronary artery disease. Examination of lungs. Examine the lungs for congestion, edema, or any other abnormalities. Weights 250 grams and higher when edematous, such as in drownings up 750 gm or more. Record findings and document photographs. Examination of kidneys. Inspect the kidneys for signs of renal failure, infarctions, or any anomalies. Normal weight range 200 to 250 grams. Record findings and document photographs. Examination of aorta, largest artery of the body. Examine the aorta for atherosclerosis, dissections, or aneurysms. Think of root of aorta, thoracic, and abdominal pats of aorta. Document findings and take photographs. 9. Brain examination. Carefully remove and examine the brain for signs of ischemia or any neurological issues. Average weight is 1,500 grams. Document any findings like aneurysm. Arteriovenous malformations are hard to determine, and consider taking sections for microscopic examination. Pancreas examination. Inspect the pancreas for signs of inflammation or other abnormalities. Record findings and consider taking samples for microscopic analysis. Intestinal examination. Examine the intestines for signs of bleeding, obstruction, or inflammation. Document findings and consider taking samples for microscopic examination. Liver. Weight is 1,400 to 1,700 gm. Histology tissue sections to be done. 1 gross and microscopic examination. In addition to the gross examination, conduct microscopic analysis of relevant tissues, for example, heart, lungs, kidney, to identify cellular changes or pathologies. Photograph and/or video documentation. Continuously document all findings using photography or digital videography to create a comprehensive record of the autopsy. Toxicology. Testing. Collect specimens for toxicology analysis, which can help identify the presence of drugs or toxins that may have contributed to the death. Blood tests for HIV, hepatitis A, B, and C serology, or COVID-19 swabs taken before commencing autopsy. Concluding the autopsy. Summarize the findings, compare them to the medical history, and make a determination regarding the cause of death. Prepare a comprehensive autopsy report that includes all observations, measurements, photo and AMP, VDU graphs, and test results. Key considerations: maintain a sterile and organized work environment to avoid contamination. Use PPE. Handle evidence with care to preserve its integrity for potential legal proceedings. Collaborate with forensic pathologists, toxicologists, and other experts when necessary. A meticulous forensic autopsy in cases of heart failure due to myocardial infarction or heart muscle death is critical in determining the cause of death, providing insights into the individual's medical condition, and assisting in legal investigations. Generally, you use the same autopsy procedures for all cases of natural deaths. For violent deaths, focus as well on injuries and results of injuries. Use scales on areas of injuries. Initial documentation by forensic group. Begin by securing the crime scene and ensuring the victim's body is preserved as evidence. Document the surroundings with photographs and sketches to establish the context. Collect any potential physical evidence, such as clothing, personal belongings, or trace materials. Victim examination by forensic pathologist or forensic doctor or medico-legal officer. Conduct a thorough external examination of the victim's body to document injuries, marks, or any signs of sexual abuse. Collect physical evidence like swabs or samples from relevant areas of the body. Document any signs of struggle or trauma. Forensic laboratory tests by forensic science practitioners. Send the collected samples to a forensic laboratory for analysis. Perform DNA testing to identify potential suspects and confirm sexual assault. Test for the presence of drugs or toxins in the victim's system. Analyze any physical evidence for trace materials, such as fibers, hair, or foreign substances. Autopsy. Performed by forensic pathologist, perform a post-mortem examination to determine the cause of death and collect further evidence. Examine internal organs and tissues for injuries, diseases, or signs of sexual assault. Document injuries and gather relevant samples for histopathological analysis. Forensic histopathology. Performed by forensic pathologist, histopathologists. Analyze tissue samples from the victim's body to identify microscopic evidence of trauma, injuries, or sexual abuse. Document and interpret any abnormalities, cellular changes, or foreign substances. Provide expert testimony in court if required. Chain of custody. Maintain a strict chain of custody for all evidence to ensure its integrity throughout the investigation. Case report. Compile all findings, including photographs, lab reports, and histopathology, results into a comprehensive case report. Legal proceedings. Provide expert testimony in court to help establish the facts of the case and support the prosecution or defense. You can visualize these steps in a flowchart or as a series of illustrations to depict the process of a forensic investigation in a fatal case of female sexual abuse.
The Pros and Cons of Practicing Forensic Pathology in the Philippines, 2025. The Realities of Forensic Pathology in the Philippines, Challenges and Hopes. Is forensic pathology in the Philippines a viable and sustainable profession? Government-hired forensic pathologists, if there is any, work under agencies like PNP, NBI, PAO, or even CHR, have stable salary, access to some government resources, involvement in national-level investigations, endure bureaucracy, political influence, security risks, professional jealousy from law enforcement, and often suffer limited funding where lawyers are dominant in their respective agencies, leaving out non-lawyers. On the other hand, private forensic pathologists work independently, often hired for second opinions or private cases, have more autonomy, have higher earning potential, have ability to challenge flawed government findings, as they advertise themselves as competent, albeit with lack of working experience. They lack access to state forensic facilities, receive threats from powerful entities, and receive credibility attacks from government-hired experts. Infrastructure issues and funding constraints, such as lack of modern forensic labs, outdated equipment, and inconsistent forensic protocols compared to neighboring countries such as Singapore and as far as Australia. Underfunding affects forensic investigations, especially in provincial areas, as forensic science laboratories are concentrated in regional offices which are themselves not fully equipped. Forensic training gaps in medical schools is a reality, and lack of specialized institutions. Readiness of society and cultural resistance as Filipinos, in general trust or distrust in forensic science. Political pressure and misinformation affect forensic credibility as seen in social media. There is never-ending challenge of educating law enforcement, the judiciary, and the public on the importance of forensic evidence. There is resistance from families and communities in autopsy cases due to cultural or religious beliefs, as in our Muslim brothers. There exist professional jealousy and institutional power struggles as rivalries and institutional pride between PNP, NBI, PAO, academe-based forensic pathologists, and CHR forensic teams, leading to conflicting findings. As infighting occurs between government forensic pathologists and private practitioners, academic versus practical forensic pathologists all lack collaboration in improving the field. There is the danger of politically aligned forensic opinions that favor certain groups. Graft, corruption, and manipulation in forensic science affect forensic investigations, e.g., planted evidence, manipulated autopsy results. The influence of politicians, powerful families, and law enforcement insiders helps in suppressing or altering findings. There is a risk of forensic pathologists being used as tools for legal or political gain. Short-term solutions, as increased funding for forensic training and infrastructure, implementing standardized forensic procedures, and strengthening legal protections for forensic pathologists against political influence. Long-term solutions include establishing an independent National Forensic Science Institute, passing stronger forensic laws currently under discussion in the Senate, and potential forensic-related bills under the Marcos Jr. administration. Encouraging young doctors and scientists to consider forensic pathology despite challenges. Call for public awareness and pressure on lawmakers for better forensic systems. Lastly, encourage everyone in the forensic science field and those in the law enforcement agencies that they are there to serve our people and justice. A clear conscience prevails always in serving our society. Mabuhay ang Pilipino. Share, comment, and discuss your thoughts below.
In the Philippine Islands, the history of crime laboratories dates back to the 1800s. A captivating journey through time that unveils the evolution of forensic science. Join us as we delve into this fascinating narrative. Picture a time in 1800s under Spanish colonial rule. The first seeds of forensic science were sown. Open the door to understanding criminal crime labs emerged. Equipped with cutting-edge tools, bolstering the fight against crime. The late 20th century witnessed a crime lab revolution. The National Bureau of Investigation's NBI Forensic Science brought advanced forensic analysis to the forefront. DNA profiling, fingerprint analysis, and ballistics testing became standard procedures. The Philippine Society of Pathologists in 1998 certified the first two forensic pathologists. One of them is Dr. Noel Mene of the NBI and Dr. Raquel Fortune of the University of the Philippines. Presently, there are 3 certified forensic pathologists are waiting to be fully utilized by both the government and the private sectors. As we journey into the 21st century, the Philippines stands at the forefront of forensic science. Scene of Crime Officers SACO of the Philippine National Police was instituted. Today, the crime laboratory landscape is more diversified, with both government and private institutions contributing to justice and truth. The integration of digital forensics, cybercrime investigations, and a network of crime labs nationwide reflects a commitment to safeguarding society. In 2023, the Philippines boasts a rich history of crime laboratories, from their humble beginnings to their state-of-the-art facilities. The story is not just one of technology, but of dedication, innovation, and unwavering commitment to truth and justice. The Forensic Science Practice Upgrade Bill to include an establishment of an independent state-of-the-art forensic science institute is still in the Senate since 1998. Today, many fresh graduates of forensic science degree are waiting to be accepted and absorbed by the mainstream law enforcement agencies and the private sectors, on towards the goal of justice and truth for Filipinos. Criminology 1. Criminal law. This subject delves into the legal aspects of crime, including the Philippine Revised Penal Code and related laws. 2. Criminal Justice Administration. It focuses on the management and administration of the criminal justice system. 3. Criminal Psychology. This subject studies the psychological aspects of criminal behavior. 4. Crime Scene Investigation. It involves practical training in processing and analyzing crime scenes. 5. Criminalistics. This subject covers forensic techniques, evidence collection, and analysis. 6. Ethics in Criminology. It explores the ethical dilemmas and responsibilities of criminologists. Forensic Science: 1. Forensic Chemistry. This subject delves into the chemical analysis of evidence such as drugs, toxins, and arson residues. 2. Forensic Biology. It covers the analysis of biological evidence like DNA, blood, and body fluids. 3. Digital Forensics. This subject focuses on the examination of digital devices and data for legal purposes. 4. Forensic Pathology. It deals with the study of post-mortem examinations and causes of death. 5. Forensic Odontology. This subject involves the identification of individuals through dental records. 6. Forensic Anthropology. It focuses on the identification of human remains through skeletal analysis. Future in the Philippine private and government settings. Criminology. Private sector. Criminologists can work as security consultants, private investigators, or in corporate security. Government sector. Opportunities exist in law enforcement agencies, corrections, and as crime analysts. Future. As crime rates and security concerns persist, the demand for criminologists is likely to remain steady. Forensic Science, Private Sector. Forensic scientists can work in private laboratories, providing services to law firms or private investigators. Government sector. Opportunities are available in government crime labs, police departments, and the justice system. Future, the field of forensic science is expected to grow as technology advances, increasing the need for specialized expertise in criminal investigations. Similarities: 1. Both fields are crucial in solving crimes and contributing to the criminal justice system. 2. They involve the use of scientific methods and techniques to analyze evidence. 3. Professionals in both fields must maintain a high level of ethics and integrity. Differences between criminology and forensic science degrees. 1. Focus. Criminology primarily focuses on the study of criminal behavior, while forensic science focuses on the scientific analysis of evidence. 2. Degree. Criminology typically leads to a Bachelor of Science in Criminology, while forensic science can result in degrees like Bachelor of Science in Forensic Science or Bachelor of Science in Chemistry with a Forensic Science specialization. 3. Career paths. Criminologists often pursue careers in law enforcement, criminal justice administration, or security, whereas forensic scientists work in laboratories, crime scene investigation, and specialize in various forensic disciplines. 4. Methods. Criminologists use sociological and psychological theories to understand criminal behavior, while forensic scientists apply scientific methods for evidence analysis. Forensic science has specialties. 1. Forensic chemistry, analyzing chemical substances like drugs, explosives, and toxins. 2. Forensic biology, studying biological evidence such as DNA, blood, and body fluids. 3. Digital forensics, investigating digital devices and data for criminal cases. 4. Forensic pathology, examining post-mortem remains and determining causes of death. 5. Forensic odontology, identifying individuals through dental records. 6. Forensic anthropology, identifying human remains through skeletal analysis. Each specialty plays a vital role in providing evidence and solving crimes in the field of forensic science. The choice of specialization depends on one's interests and career goals within the forensic sciences. 22.